What's the difference between a deep plane facelift and a SMAS-plication facelift? I'm board-certified facial plastic surgeon, Dr. Delaney. Let me explain to you further. Before we jump right into it, let me provide some basic anatomy as well as some definitions so you can. All right, we've got here a great illustration by Surek and Moorfield. And so basically, this is taking the different layers of the face and kind of expanding it and labeling it. So it's really easy to understand. So I think this is really good for demonstration purposes. So if you look at the face, we think of the face in terms of different layers. And all the way here on the left-hand side, or the skin there, you can see number 1. So that's our skin. Okay. Number 2 is our subcutaneous tissue. Number 3, this is the SMAS layer, superficial musculoaponeurotic system. So this is the layer on which most facelift surgeons perform their surgeries. This is a dense fibrous connective tissue layer, so you get much better pull. And when you place the pull on this layer, then you take tension off the skin. So you have much better looking scars because there's no tension on the incisions themselves. In number 4, that's the deep plane. So this is the area where there is potential space. And then also number 5 there, that's the deepest layer. So that's the deepest structures down onto the face. So over here would be the masseter muscle. Up top, that would be your temporalis muscle. So that we don't go any deeper than that. So what's also really nicely demonstrated with this illustration of the deep face anatomy is you can see all those white structures going across. So those are the facial retaining ligaments. So those ligaments help keep the face in place so you don't slide, your skin doesn't slide off as you age. However, when performing facial rejuvenation surgery, you also have to take those into consideration because if you don't treat them, what will happen is as you pull the tissue up, the tissue will get kind of stuck around those ligaments, and you can still get a good pull, but you don't get as nice, as powerful of a pull, and you have a little bit unnatural appearances around kind of those little areas of attachment where it's kind of forms like a little bit of a pivot point. Also important to note that in the deep plane or the forked plane, we do see the facial nerve. We recognize that that's an important structure, of course, because that controls movement of the face. However, it's the analogy I give people is, it's like knowing that there's a stop sign at the end of the block. You know it's there. You look out for it. You slow down. So it's not like you're going to speed through that intersection. So as long as you know your anatomy, which most facelift surgeons perform deep plane do and do very well, then it's really not that much more of a risk than any other type of facelift. Okay, so now that we have our anatomy set, next I want to go over some definitions. So a deep plane facelift, the deep plane is in plane number 4 here, okay? And basically, it's what is it deep to? It's deep to the SMAS. Okay, SMAS is plane number 3. And so what we found is by going into the deep plane, plane number 4, we're able to keep a much thicker overlying composite skin flap, composite of skin attached to the SMAS. And I'll show you in the next image why that is important. And then we're able to then go in and free up the ligaments, which you can see are in layer 4 as well as layer 2. So we could get much better, much more natural pull in a vertical fashion. Now, you may be looking at this and saying, well, it looks like you can release the ligaments in layer 2 as well. And that is true. However, if you just release in layer 2 and you don't release in layer 4, the SMAS, which is the layer on which we are pulling, is still attached to the underlying structures. So you're able to move the skin, but you're not able to move the SMAS as well. So you really want to release in layer 4 to get as good of a lift as possible. Now, let's talk about SMAS-plication. Plication, which comes from the root word plica, which means fold. Okay, so plication is an older technique where surgeons will take basically the SMAS layer and fold it on itself. So we'll pull it up and fold it on itself. And that works very well, particularly in cases where there's some loose skin down here or if there's not a lot of aging. However, what I've found is what will happen is because those ligaments aren't released, you do have to pull a little bit harder to get a good lift that stays there. And if you get some a little bit unnatural tethering around those points where the ligaments are in the way. And also, the ligament, especially this one right here on the cheekbone, you can see that's a really big one. And that one will prevent a SMAS-plication surgeon from getting into the nasal labial folds to get as good of a lift. So that's why I prefer the deep plane, because you can release that ligament and you can get all the way here and get a better lift here, not just here along the jawline, but also by the corner of the mouth, as well as the nasal labial. And here's a really nice illustration by Dr. Elboul and Codner that really nicely demonstrates the different ways you can pull up the tissue. And so I'll go over these one by one. You may need to see this a few times. It can be a little bit confusing at first. Basically, we're looking at those same 5 planes that we're just looking at, but we're sideways now. Okay, so the top layer is skin, underneath that subcutaneous, SMAS, deep plane, and then layer number 5 is our deep surface. So if you look at example number 1, this is how surgeons initially started doing facelifts. They were just basically freeing up the skin only and pulling it. You can see the SMAS layer is untouched. The ligaments are left in place. And we found that the results were very short-lived because skin naturally is stretchy. And even if you pull it tight and remove it, it'll only last a year or 2. Number 2, you could see, so surgeons started recognizing, okay, maybe we need to do something to the SMAS. And then so they would elevate under the skin, elevate under the SMAS, and release the ligaments. So they're getting much better pull. But what they were finding is, because they were elevating so much of that skin, when you elevate the skin, you get swelling, you get numbness, you get decreased blood flow. So they're definitely getting better results, but there's something that, room for improvement, so to speak. And then we're looking at number 3. Okay, so this is kind of the deep plane that we do now. It's a deep plane composite. So basically, that means we enter into the deep plane as early as we can out here. So we maintain a nice composite flap of tissue of skin, subcutaneous, and SMAS, so that they're all together. So you get less swelling, better healing, less strain on the overlying skin, because a lot of the blood vessels run in that subcutaneous plane. And so this is how we're able to get patients, back to their normal lives much faster, because we maintain a thicker, more healthy composite flap and still get incredible results. Then number 4 here, that's an example of what the SMAS-plication looks like. So basically, what you do is you get a wide undermining in the subcutaneous plane to expose the SMAS layer, and then you grab the SMAS and you fold it in on itself. So you can see you're basically folding the SMAS, you're not releasing it, so you'll still get an improvement. You may get some unwanted fullness in certain areas, and you're not treating, probably what's the biggest, most important thing to treat is the deep facial ligament. So I know that was a long discussion. Hopefully with some of the images and the explanation, you have a much better idea of the differences between the deep plane and the SMAS-plication. In a separate video, I'll also talk about when someone may actually want a SMAS-plication surgery. If you have any other questions, please leave them in the comment below. I look forward to seeing them.